First, and I would like to talk about the role of baseline spectroscopy and ADC biomarkers as the early recurrence predictors for the patients with glioblastoma. No conflict of interest. So, as we everybody know that the critical biological characteristics of glioblastoma is unfortunately unavoidable tumor progression after standard therapy. And overall survival for such a patient is less than 1 year. And tumor recurrence develops in almost all patients despite the aggressive standard first-line treatment, which includes surgery, radiotherapy, and concomitant or adjuvant chemotherapy. Multiparametric MRI utilizes advanced imaging methods such as DWI, ADC mapping, proton MR spectroscopy, and these methods gives us an opportunity much more deeper but still non-invasive insight into the interpretation of brain tumor and resulting in a greater specificity of diagnostic imaging. So we conducted our retrospective single institutional study with the aim to determine prognostic utility of the main metabolite concentrations obtained by MRS and the values of ADC at the baseline diagnostic MRI study in stratification patients for the early and late recurrence. In this example, we have the patient first scan is a baseline MRI with a zone of irregular mild enhancement. We may see it here. And the second slide is postoperative MRI 2 weeks from baseline. And the third example is first control after 3 months from the end of radiotherapy. And we may see an enhancement involving a corpus callosum is early recurrent of a glioblastoma. So, our study population, we got 27 patients selected from our local database, which got a recurrence of glioblastoma, and the recurrence was proven either with surgical biopsy or MRI surveillance. Prior to the relapse, all the patients undergone gross tumor resection and received intensity-modulated radiotherapy, combined with concurrent or adjuvant temozolomide as a primary treatment in high-grade gliomas. So, MRAs and ADC parameters as pre-treatment baseline diagnostic studies were analyzed for their potential to predict early recurrence. All patients' data were obtained by using 1.5 Tesla scanner and with using extended brain protocol with the next sequences. And the next slides I'm going to talk about the last one. And there are two basic techniques utilized in MR spectroscopy: single voxel technique and multivoxel technique. In our study, we used a multivoxel technique. Is also called chemical shift imaging. This technique allows us to obtain spectra from the large volume of interest and is better suited for evaluation of large size of glioblastoma. To provide information about metabolites, intermediate time echo was chosen, and here is example. It's a multivoxel MRS with the intermediate time echo. And data was recorded for peaks of lipid lactate, choline, N-acetyl aspartate, and creatine, and used to calculate the ratio. In the examples, in the first one, we may see the baseline spectroscopy showing both peaks of choline and creatine, and the second one is a measurement of peaks of N-acetyl aspartate. Apparent diffusion coefficient parameter is known for correlation with the glioblastoma cellularity, and ADC measurements are taken as a suspicious region and compared to a normal brain tissue of the similar region of contralateral hemisphere. ADC mean and ADC max in regions of interest and were delineated manually, and Excel images and normalized ADC ratio also was calculated. So, short about therapy and surgery. All of these patients got a gross tumor resection, and during the radiotherapy course, 60 grays were administered for the gross tumor evaluation, and delineated gross tumor volume had an isotropic expansion of 20 millimeter for the clinical larger volume. A little bit about statistical analysis, boring part, but it's so really important. We used this PSS statistic software to calculate, and the Fisher exact test in the non-parametric Mann-Whitney U test were used with continuous and non-continuous variables to establish any difference between the subgroups of early and late recurrence. I'm going to show the table here. Is the basic characteristics of the study sample, and we may see here the mean age of our patient was 47 years old. We got 10 males and 17 females. Here are the parameters of radiotherapy. 100% of our patient got 6 degrees, and also all of them got a temozolomide chemotherapy. Here's mean time to relapse. It's almost 10.5 months. Also, what we could measure and include here, it was maximum diameter of primary glioblastoma, and gross tumor volume also were included in our study. So it's numbers and calculation of statistic. I'm going to show you the next slide. Is result. We divided our cohort of patients into two subgroups with early recurrence, the first column here, and the late recurrence. So the subgroup with early recurrence showed us significantly higher levels, which marked here with dark blue arrows. It was a high level of lipid lactate, choline, and acetylaspartate and creatine, and also high levels of ratio choline-creatine and acetylaspartate creatine, and lipid lactate creatine ratio was really significantly high. Unfortunately, parameters of ADC and GTV didn't show us they showed us mild correlation with early recurrence for the patient. And here is a kind of values of the most important MRI parameters for potential to early recurrence with related sensitivity and specificity. The sensitivity was almost 100% in all parameters. And here's the numbers of specificity. Also, this is ROC curves analysis and the calculated areas under the curve. Discriminatory power of the parameters to predict early relapse was assessed by receiver operating characteristics curve analysis and calculated errors under the curve. So, of course, I would like to mention about the limitations of our methods. It's a low cohort of patient and retrospective study. Of course, it was single institutional study and using monoscanner, monoprotocol. We hope to resolve this problem using multi-institutional, I hope in the future it's going to be a multi-institutional study, and we're going to, with an expansion of a cohort of our patient. If it's going to work in all scanners, it's going to work at all. So, to be brief and taken in account, so I would like to conclude that the baseline glioblastoma parameters may have their prediction potential in early versus late recurrence patient stratification, and in the future may used as an imaging biomarker in differential diagnosis for the patients with the early and late recurrence of this tumor. Thank you for paying attention, and that's all.
Don't mind, I have just one question. In the slide where you were talking about the DVI ADC protocol,